Yes, so we gave you a broad overview, starting from use cases and then raining down as to what MCWG is doing for intra-country. You now have MyFATU that is doing the cross-border, XTHR who is doing the intra-border, working in collaboration with similar people working in MCWG and in XTHR. So far things have been moving fairly well and consistently for imaging. We still have a little bit of a deficit of perception. Number of countries are saying, oh, imaging is difficult. We're not sure we're going to be ready. Actually, I believe that if we look around, we discover that the issues in imaging have essentially all been addressed. The specifications are on the table. We even went at looking how to make the rest of the HDS consistent, not to make imaging look like a little bit of an odd thing. So that is where we stand. When you look at the schedule, MyFATU should produce, XTHR should produce its specification for April, and get the first round of review over the summer. So that gives you a bit of a sense as to what's going to happen in 2025. The deployment of imaging in MyFATU for cross-border is planned in wave 9, which will start end of this year. No?
End of next year.
Wave 9?
Yes. This time it will be wave 8.
Oh, wave 8, okay, sorry, yeah. So that's kind of how things are shaping. I don't know if you have further questions, comments. Done? You're tired. This is a good audience.
I think maybe one last comment is the work that's done sort of cross-border. We're trying not to impose any requirements on the national infrastructure of a country. We're trying to ensure that the approaches that are taken are sufficient, that we're not making that kind of imposition, and that there will always be, via the national adapter, which is basically the software that glues the national contact point to the national infrastructure, that in there, that's where that magic has to happen between the choices that were made at a national level for whatever kind of sharing environment is in that country, that is the translation point, if you like, to support the cross-border. And I think that's something that is very important, that we are trying to it's very difficult to actually do it, but to try and make sure that we don't impose too much of a request or requirement on the national infrastructure of a country.
Good, so if you want to know more about all of the MCWG specification and recommendation, you can look for MCWG, you put Aichi MCWG, and you will be directed to the page on the Aichi Europe website. And if your country is interested to join, you are welcome. Do not hesitate to contact me. We now have 11 countries engaged, and a very, very good level of work of efficiency.
We need some funding
Thank you.
for implementation.
Oh, sorry?
We need some funding though for implementation of those services and all those standards to use them in our country though. So we'll have to figure out how to get some funding for those things or for all those things.
To involve the patient?
You know,
No.
for employing the medical images and all those standards that has to be used.
Yeah?
So we need some funding though to do all of this. So we'll have to figure out how to get some funding on that.
Right, but the deployment and the system that need to be deployed are essentially standard of the shelf packs, race, modality. You know, we are very careful to allow the sharing of images to not negatively impact the existing install base. And you know, France gave us an example of how you adapt the existing install base at a large scale and in a short time frame, in a year or year and a half. So I would say there is probably a couple dangerous things that you need to think about that very often people confuse. They say, okay, I need to share images. I'm going to create a regional packs, and my regional packs will give pack services in a variety of imaging centers and hospitals, and I will use it to share images at the regional level. Sounds like a great idea. Oh, why don't I do a national packs and use the national packs as a way to share images at the national level? Sounds like a great idea. Very bad idea. It's a bad idea if you think you're using your packs as a sharing tool. A PACS is a great sharing tool between people within a hospital and a variety of well-known workflows of image production and reporting and all of that. PACSs are not designed, although a number of them can do that, to start sharing images between various entities. And hosting a PACS as a production system is a perfectly good idea. And doing that as a national level or regional level or wherever you want level is a perfect deployment. However, when you're building sharing of information, relying on a specific system and assuming that all of the images in a country or in a region will be produced under that PACS is a fallacy. That PACS will be replaced before all of the institutions are connected. You're always going to find some individual imaging centers that are, or specialized hospitals that are not connected on the regular PACS, because the regular PACS is not what those specialized hospitals are doing. So at that time, you discover that although you have one PACS that covers, 70, 80, 90%, it never covers 100%. So therefore, you need to think of your national infrastructure in sharing images, not connected with the production PACS. You may have a large national PACS, and this as part of the sharing infrastructure, but it's not going to be the only one creating and using images. There will always be others. So that's what needs to be done, and we've seen countries that have done that. An example is, for example, Ireland. Ireland has a national PACS and has had it for 10 or 15 years. Yeah, it covers 70% of the hospital. What about the remaining 30%? They've forgotten. How are you going to connect them? Are you going to connect them to the national PACS? I don't know, because they're not a public hospital, so they're not supposed to connect there. But you want them to exchange information with the other PACS and outside of the country. Oops! We've taken a solution which is good, but that was intended for a production system, and we've turned it into an implicit sharing system, which is not intended for that. Now it needs to be connected and integrated with the sharing system, but you want to split the two. By putting a VNA at the national level may help, but not all images of a country will be in national VNA or regional VNA. There will be others in other VNAs that are private, specialized, and all of those things. So, always important to think of the national sharing infrastructure as a national good for the long term, and understanding that you want to have freedom to add, remove, change, replace all of those production systems. Because the production system have a very quick evolution. They very often need to be replaced. And when they are replaced, it's a pain to replace it for the production entities, let's say hospitals. But then if it becomes a national pain, in addition, double whammy, very, very, very bad. So those are important elements, and when you look at what MCWG has done, is you discover that you can apply the MCWG principle to interconnect all of your PACSes in your country, although there may be a huge one and a few small ones, doesn't matter, they have to be interconnected, and from their interconnection you get the cross-border interconnection. So those are kind of lessons learned that were not obvious 10 or 15 years ago, but those are mistakes we should not be repeating today. But it's hard to explain to a politician that, oh, you need to pay for a production PACS system hosted at the national level, but you need to also have a sharing infrastructure to which that PACS system is going to be connected as well as others. And the two are needed. And the two should not be confused. The second one is going to be fairly simple and trivial to do. And you probably need it for other things than imaging anyway. So if you have already deployed other services, you already have probably most of that infrastructure in place. So imaging should not be some kind of a tower in itself. And that is what we do with XCHR. We make very sure that in the way we are moving and accessing information, we don't make imaging a tower in itself. It cannot live independently. You have to be able to query at the same time for an imaging report, for an imaging study, and a lab report. One query, period. If you don't do that, then you're not dealing with the clinician needs. A little bit provocative, but worth a couple of discussions. Other points or other thoughts? No? Thank you. Wish you a good rest of your evening, and see you at the reception tonight. It's what, 7:30 on the deck? It was that, there is not one tonight?
It was last night.
It was last night, okay, but I saw an announcement saying there is one tonight. Mistake?
I don't know.
You don't know? I don't know either.
We'll check outside. We'll check outside.
We'll check outside.
I think
Okay.
it was last night.
Thank you again.